Hi, welcome to our channel of IGNOU audiobooks, Indira Gandhi National Open University, School of Engineering and Technology, SOET, Diploma Postgraduate Diploma Programs, Postgraduate Diploma in Industrial Safety, PGDINDS, Semester 2, MEV-005 Occupational Health and Safely, Block-1 Basic of Health, Unit-2 Environment and its Impact on Health, 2.0 Introduction. You have already read from the previous units that environment refers to all the external conditions, circumstances, and influences surrounding and affecting the growth and development of an organism or community. Thus, environment is defined as all that is external to the individual human, host, living and non-living, and with which he is in constant interaction. John M. Last, the environment may be macroenvironment. The macroenvironment includes broader factors which affect community as a whole. The broad environment is made up of 6 components: demographic, economic, physical, technological, political, legal, and social cultural. An environment. Microenvironment is the immediate environment in which man lives. You have already read about the concept of health and disease in the previous unit. In this unit, you will learn in detail about environment, various components of environment, and the relationship between environment and health. You will learn that how environmental factors play an important role in human health and well-being. We will discuss that exposures to various physical, chemical, and biological risk factors result in diseases in human being. Due to industrial revolution, increased use of chemicals in agriculture, and other human activities, there has been environmental degradation in last few decades, which is resulting in ecological imbalance and poor health. Environmental interventions are required to reduce the disease burden. 2.1 Objectives. After going through this unit, you should be able to define the term environment and describe its physical, biological, and psychosocial components, discuss the influence of environment on human health, enumerate and discuss the environmental hazards affecting human health. Discuss various environmental interventions for reducing the disease burden. 2.2 Components of environment. Environment can be divided into 3 components: physical, air, water, soil, housing, climate, geography, heat, light, noise, debris, radiation, etc. Biological, man, viruses, microbial agents, insects, rodents, animals and plants, etc. Psychosocial, cultural values, customs, beliefs, habits, attitudes, morals, religion, education, lifestyles, community life, health services, social and political organization. These components are closely related. Human beings are in constant interaction with all these components of environment, which have a bearing on health. Importance of environment in health. As discussed in the last chapter, environment is one of the components of the epidemiological triad. Various disease conditions appear when there is an interaction of the agent, host and environment, including the human activities affecting the environment. We need safe, healthy and supportive environments for good health. The environment in which we live is a major determinant of our health and well-being. We depend on the environment for energy and the materials needed to sustain life, such as clean air, safe drinking water, nutritious food, safe places to live. Many aspects of our environment, both built and natural environment, can have an impact on our health. 2.3 Environmental health. Environmental health is the study and management of environmental conditions that affect the health and well-being of humans. Environmental health comprises those aspects of human health, including quality of life, that are determined by physical, biological, social, and psychosocial factors in the environment. These factors have been elaborated in the Fig. 2.3. The biological factors generally refer to the disease-causing agents like the microbes. The physical factors refer to the temperature, humidity, precipitation, wind, etc. The chemical factors refer to the allergens, chemical, pollutants, etc. The psychological factors include the stress, interpersonal relationships, etc. It also refers to assessing, correcting, controlling, and preventing those factors in the environment that can potentially affect adversely the health of present and future generations. 2.4 Environmental hazards. Environmental hazards may be biological, chemical, physical, psychological, sociological, or site and location hazards. Biological hazards, these are living organisms or their products that are harmful to humans. Waterborne diseases are diseases that are transmitted through drinking water. G. Poliovirus, hepatitis A virus, salmonella, shigella, cholera, amoebic dysentery, giardia, and cryptosporidium. These disease organisms can produce illness in those who consume untreated, contaminated water. Foodborne diseases. G. Salmonella, serotype enteritidis, Escherichia coli, 0157H7, as well as other agents, vector-borne diseases. Improper environmental management can cause vector-borne disease outbreaks, e.g. malaria, dengue, filariasis, kala azar, etc. Arthropod-borne diseases, diseases transmitted by insects or other arthropods, e.g. Examples are St. Louis encephalitis and La Crosse encephalitis transmitted by mosquitoes, and plague and murine typhus transmitted by fleas. Physical hazards, these include airborne particles, temperature, humidity, equipment design, and radiation. Psychological hazards, these are environmental factors that produce psychological changes expressed as stress, depression, and other mental health conditions. Sociological hazards, these result from living in a society where one experiences noise, lack of privacy, and overcrowding. 2.5 Impact of environmental hazards on human health. There is growing concern about the links between the environment and health. Humans are responsible for polluting the environment, which in turn has shown its effect on the human health. The health and environment are interlinked. It has been estimated that 24% of the global burden of disease and 23% of all deaths were due to modifiable environmental factors, for example, pollution, occupational risks, land use practices, and sanitation. Table 1. Environmental hazards and related human health effects. Environmental hazard and examples of health effects. Outdoor air pollution, respiratory conditions, cardiovascular disease, lung cancer, unsafe drinking water, diarrheal, gastrointestinal illnesses, mosquitoes, ticks and other vectors, malaria, dengue fever, rickettsial disease, UV, ultraviolet light, exposure too much, melanoma, non-melanoma skin cancer, eye cataracts too little, vitamin D deficiency, leading to rickets, osteoporosis, and osteomalacia, second-hand smoke exposure, respiratory diseases, lung cancer in children, asthma, lower respiratory infections, middle ear infections, household crowding, infectious diseases, including lower respiratory infections, cold and damp housing, excess mortality, climate change, infectious diseases, including giardiasis, cryptosporidiosis, and salmonellosis, heat stroke, hazardous substances poisoning, burns, dermatitis, lead in children, developmental delays, behavioral problems in adults, increased blood pressure, asbestos, breathing difficulties, lung cancer, mesothelioma, noise, hearing loss, cardiovascular problems, insomnia, psychophysiological problems, environmental catastrophes that resulted in high mortality, Minamata disease, 1953 to 1961, methyl mercury poisoning, Bhopal, 1984, 16. 5 tons of toxic pesticide released, Chernobyl, 1986, nuclear reactor accident, Milwaukee incident, 1993, cryptosporidium in drinking water. In the least developed countries, 1/3 of death and disease is a direct result of environmental causes. The major causes of environment-related morbidity and mortality are discussed below. 2.5.1 Air pollution, clean air is a basic requirement of human health and well-being. According to WHO, more than 2 million premature deaths occur each year due to air pollution. More than half of this disease burden is borne by the populations of developing countries. Indoor air pollution. More than 3 billion people worldwide continue to depend on solid fuels, including biomass fuels, wood, dung, agricultural residues, and coal, for their energy needs. Cooking and heating with solid fuels on open fires or traditional stoves results in high levels of indoor air pollution. Indoor smoke contains pollutants, particulate matter, and carbon monoxide, which may be 20 times higher than accepted values. As per the World Health Report, indoor air pollution is responsible for 2.7% of the global burden of disease. 2.5 point to safe water. A large proportion of the world's population is facing water scarcity. Shortage of safe water is worsening due to population growth, urbanization, and the increase in domestic and industrial water use. It has been indicated that by 2025, nearly 2 billion people will be living in countries or regions with absolute water shortage. Water scarcity forces people to rely on unsafe sources of drinking water. Poor water quality can increase the risk of diarrheal diseases including cholera, typhoid fever, salmonellosis, other gastrointestinal viruses, and dysentery. It also promotes trachoma, plague, and typhus. Due to shortage of water, people have to store water in their homes. It can increase the risk of household water contamination and provide breeding grounds for mosquitoes, which are vectors for dengue, hemorrhagic fever, and malaria and other diseases. 2.5.3 Sanitation and safe excreta disposal. Sanitation refers to adequate treatment and disposal of human excreta and sewage. It prevents human contact with feces and aims to protect human health by providing a clean environment that will stop the transmission of disease, especially through the fecal-oral route. Sanitation is critical for preventing many diseases including diarrhea, intestinal worms, and trachoma that affect millions of people. Ensuring universal access to sanitation in households is essential in reducing disease, enhancing safety, and well-being, especially for women and girls. As per latest estimates, globally 2.3 billion people still lack a basic sanitation service, and as many as 892 million people practice open defecation. In India, Swachh Bharat Mission, which aims to provide access to sanitary latrines to all, is a step towards improving environmental sanitation. 2.5.4 Ecosystem change. Land change due to damage by erosion, salination, or chemicals has impacts on health. Increasing pressures of agricultural and livestock production are stressing the world's lands and pastures. Desertification affects human health through complex pathways. Increased poverty due to less nutrition, population displacement, water, food, and vector-borne diseases, and air pollution. 2.5.5 Climate change. Health. Marked short-term fluctuations in weather can cause acute adverse health effects. Extremes of heat and cold lead to heat stress or hypothermia, increasing death rates from heart and respiratory diseases. Weather extremes, heavy rains, floods, and hurricanes also have severe impacts on health. Approximately 600,000 deaths occurred worldwide. Weather-related natural disasters in the 1990s, and 95% of these were in poor countries. Examples: frequent cyclones, earthquakes, and other natural disasters in various parts of the world. Climatic conditions affect diseases transmitted through water and via vectors, such as mosquitoes. 2.5.6 Global warming. About two-thirds of solar energy reaching Earth is absorbed and heats the Earth's surface. The heat radiates back to the atmosphere, trapped by greenhouse gases, such as carbon dioxide. This greenhouse effect regulates surface temperature. Human activities, particularly burning of fossil fuels over the last many years, have released large quantities of CO2 and other greenhouse gases to affect the global climate. the atmospheric concentration of carbon dioxide has increased by more than 30% since pre-industrial times, trapping more heat in the lower atmosphere. It has resulted in melting of glaciers, rise in sea level, climate changes, which in turn have led to displacement of habitation, increased diseases, particularly vector-borne and other communicable diseases. 2.5.7 Noise. Globally, some 120 million people are estimated to have disabling hearing difficulties. A large proportion of the world's population lives in noisy surroundings. Exposure to noise can have many health impacts. These are described as follows: prolonged or excessive exposure to noise can cause hypertension and ischemic heart disease. Above 80 decibels may increase aggressive behavior, disturbed sleep, etc. 2.6 Waste and human health. Improper waste management can have negative impacts on both environment and public health. Negative impacts can be due to different handling and disposal activities resulting in soil, water, and air pollution. Inadequately disposed of or untreated waste may cause serious health problems for populations surrounding the area of disposal. Leaks from the waste may contaminate soils and water streams and produce air pollution through emissions of, e.g., heavy metals and persistent organic pollutants, POPs, ultimately creating health hazards. Other nuisances caused by uncontrolled or mismanaged waste disposal which may affect citizens negatively include impacts at local level, such as landscape deterioration, local water and air pollution, as well as littering. Managing waste properly and in an environmentally sound way is therefore important for health reasons. Unattended waste lying around attracts flies, rats, and other creatures that in turn spread disease. Normally, it is the wet waste that decomposes and releases a bad odor. This leads to unhygienic conditions and thereby to a rise in the health problems. Various types of wastes are 2.6.1 Solid waste has become contaminated either due to waste dumping or leakage from landfill sites. Uncollected solid waste also increases risk of injury and infection. In particular, organic domestic waste poses a serious threat since they ferment, creating conditions favorable to the survival and growth of microbial pathogens. Direct handling of solid waste can result in various types of infectious and chronic diseases, with the waste workers and the rag pickers being the most vulnerable. Waste from agriculture and industries can also cause serious health risks. Disposal of industrial hazardous waste with municipal waste can expose people to chemical and radioactive hazards. Uncollected solid waste can also obstruct storm water runoff, resulting in the forming of stagnant water bodies that become the breeding ground of disease. Waste dumped near a water source also causes contamination of the water body or the groundwater source. Direct dumping of untreated waste in rivers, seas, and lakes results in the accumulation of toxic substances in the food chain through the plants and animals that feed on it. 2.6.2 Hazardous waste. Annually, about 12 million tons of inert waste are generated in India from street sweeping and construction and demolition debris waste, and in the landfill sites. It occupies about one-third of total MSW. Annually, about 12 million tons of inert waste are generated in India from street sweeping and construction and demolition debris waste, and in the landfill sites, it occupies about one-third of total MSW. Exposure to hazardous waste can affect human health, children being more vulnerable to these pollutants. In fact, direct exposure can lead to diseases through chemical exposure, as the release of chemical waste into the environment leads to chemical poisoning. Many studies have been carried out in various parts of the world to establish a connection between health and hazardous waste. 2.6.3 E-waste. E-waste like refrigerators, computers, washing machines, etc. comprises a source of a variety of materials that can be recovered and brought back into the production cycle. Over 1,000 different chemicals, as heavy metals, polycyclic, aromatic hydrocarbons, PAS, polychlorinated biphenyls, PCBs, and brominated, flame retardants, are identified in the e-waste streams. The population exposed to potentially hazardous substances through inappropriate and unsafe management practices related to e-waste is increasing. Given the pollutants involved, health effects from treatment of e-waste may include neurodevelopmental outcomes. A recent review recorded plausible outcomes related to alterations in thyroid function, associations of exposure to chromium, manganese, and nickel with lung function, adverse birth outcomes, preterm birth, low birth weight, stillbirth, and congenital malformations, behavioral alterations, as well as DNA damage and chromosomal aberrations in lymphocytes. This relatively recent and growing problem needs to be addressed by suitable epidemiological studies in vulnerable populations, such as pregnant women and children. 2.6.4 Healthcare waste. Of the total amount of waste generated by healthcare activities, about 85% is general, non-hazardous waste comparable to domestic waste. The remaining 15% is considered hazardous material that may be infectious. Chemical or radioactive. Disposal of hospital and other medical waste requires special attention, since this can create major health hazards. This waste generated from the hospitals, healthcare centers, medical laboratories, and research centers such as discarded syringe needles, bandages, swabs, plasters, and other types of infectious waste are often disposed with the regular non-infectious waste. Of the total amount of waste generated by healthcare activities, about 85% is general, non-hazardous waste comparable to domestic waste. The remaining 15% is considered hazardous material that may be infectious, chemical or radioactive. Healthcare waste contains potentially harmful microorganisms that can infect hospital patients, health workers, and the general public. Other potential hazards may include drug-resistant microorganisms which spread from healthcare facilities into the environment. Healthcare waste is a reservoir of potentially harmful microorganisms. Every year, healthcare waste results in millions of hepatitis B, HIV, and hepatitis C infections. Wastes and byproducts can also cause injuries, e.g., radiation burns or sharps-inflicted injuries, poisoning and pollution, mercury, antibiotics, cytotoxic drugs, etc. 2.7 Environmental action. It is understood that healthier environments could significantly reduce the incidence of cancers, cardiovascular diseases, asthma, lower respiratory infections, musculoskeletal diseases, and road traffic injuries, reducing the disease burden through environmental interventions. Environmental health intervention helps to achieve reduction of the diseases in several ways, providing sustainable sources of safe water and clean energy are key. Environmental interventions. Environmental interventions will likely have a great impact on improving the health of slum dwellers, who are among those most affected by the combined health hazards associated with polluted water, inadequate sanitation, urban ambient air pollution, and indoor air pollution from solid fuel use. Environmental health interventions can make a valuable and sustainable contribution towards reducing the global disease burden and improving the well-being of people. Much of the death, illness, and disability could be prevented. Promoting safe household water storage, provision of sanitary latrine and safe disposal of human excreta, use of cleaner and safer fuels, other interventions for healthy environment, increasing the safety of buildings, promoting safe, careful use and management of toxic substances at home and in the workplace, and better water resource management. 2.8 Summary. In the present unit, we have learnt about the definition of environment, different components of environment, and influence of environment on health of a person. We also studied various environmental hazards. Various causes of environment-related morbidity and mortality have also been discussed. Finally, we studied various environmental interventions to reduce disease burden and improve health of populations. Thank you. Subscribe to our channel for more updates, and we will see you with the next chapter.